Hello, I'm Dr. Crystal Cheong. Is your partner's snoring keeping you awake? Do you experience choking or gasping episodes at night? Do you often feel tired and lethargic even after sleeping for many hours? Today, I will be sharing with you why people snore and whether snoring means you have obstructive sleep apnea or OSA, and what exactly is OSA. Snoring is the sound that is produced when tissues in our upper airway vibrate. Vibration happens when the airflow is narrowed by excessive tissue growth, for instance, or when floppy tissue moves as air passes over it. Sometimes, snoring happens while a person is breathing normally with adequate airflow. This is known as simple snoring. If snoring occurs sporadically, like when you have a cold and your nose gets blocked, or after consuming some alcohol, it is probably nothing to be concerned about. But snoring could also be a sign of a more serious condition called obstructive sleep apnea or OSA. Individuals with OSA experience brief interruptions in their breathing during sleep. During each breathing interruption, airflow is reduced. The oxygen level in the body may decrease, and the brain may jolt you awake in response to the reduction in airflow. In the long term, these are some conditions closely related to OSA. High blood pressure, irregular heartbeat or arrhythmias, heart attacks, strokes, diabetes, and poorer neurocognitive abilities. An overnight sleep study, which can be conducted at a sleep laboratory in the hospital or at home, is required to diagnose OSA. Airflow is measured via thin tubes placed near your nose and mouth. Monitors are pasted on your scalp to detect the level of sleep and brain activity through the night. The amount of effort required for each breath, eye movements, heart rate, oxygen level, eye and limb movements, and body position will also be recorded. The data captured is analyzed to diagnose if you have a sleep breathing disorder or other sleep conditions. Your doctor may suggest that you start using a continuous positive airway pressure or CPAP machine during sleep. It gently blows air into your upper airway through a mask fitted over your nose and sometimes covering the mouth as well. The constant stream of air prevents your upper airway from collapsing. CPAP is the most effective way to stabilize the airway and stop snoring. However, some may find it uncomfortable or inconvenient. There are some basic measures that can improve sleep breathing. Lifestyle changes like weight loss reduces accumulated fat in your tongue and neck region, which reduces bulkiness in the airway. Relieving nasal blockage also improves overall breathing. Some things that can worsen nasal blockage are house dust mites, cockroaches, cats, dogs, and pollen. Sleeping on your side helps to increase the size of your airway, as the tongue does not drop as far back into the throat as compared to when sleeping on your back. Positional therapy in the form of specially designed props or pillows assist with maintaining a side sleeping position. In some cases, using an oral appliance during sleep, like a mandibular advancement device, can help to open and stabilize the airway by pushing out your lower jaw. It is advisable to consult a dentist to assess the health of your teeth and jaws before embarking on this treatment. Finally, surgery is an option to treat OSA. Many surgeries exist for different parts of the upper airway, ranging from nasal surgery, mouth and throat surgeries such as tonsillectomy and palate surgery, to jaw surgery. An alternative treatment to permanently changing the structure of the upper airway is hypoglossal nerve stimulation. This involves putting in a small implant into the upper chest and neck. The implant is switched on by the patient before sleeping, and it opens the airway by stimulating the tongue to move forward away from the back of the throat. The patient turns it off once he or she wakes up. Every patient's condition is different, so it is best to discuss your options with your doctor. Simple snoring is fairly harmless. It is more a social annoyance than a health hazard. However, snoring may be a warning sign of OSA, which is linked to many health consequences. Continuous positive airway pressure, or CPAP, is the first-line treatment for patients with OSA. It keeps the airway open and is low risk. OSA is unlikely to spontaneously disappear unless there are major changes like significant weight loss or surgery to change anatomy. In the absence of those changes, it is likely that your doctor will recommend that you be on lifelong CPAP. A patient may undergo surgery with different goals in mind: for cure, to achieve reduction in their OSA, or to help them use other treatments like CPAP more comfortably. Surgery can be very helpful for some patients, but does not cure everyone. Please consult your doctor for the best treatment option. I hope this video has helped to increase your understanding of snoring and OSA. Thank you for watching.